Today on Investigate TV Plus, when it comes to shopping for your baby, you expect the products on the shelves to be safe. I'm Tisha Pell.
And I'm Lee Zurich. Our investigation found that isn't always the case.
The fact that anyone can just make an infant product and put it on the market is really scary. And there is this assumption that if something's on the market, then it's safe.
We take an in-depth look at the system charged with regulating baby items and why advocates say its slow movement costs lives.
Plus, some physicians argue the current healthcare system puts profits over patients. We examine an emerging model that looks to grant faster and longer access to your doctor.
Then,
it's truly an art.
Raising donations.
It makes me feel good when I'm going to do the delivery and the person I'm doing the delivery to is like, oh my God, we're so glad to see you.
The grassroots effort rescuing baked goods for a good cause. In-depth stories that inform and inspire. You're watching Investigate TV Plus. When toys and infant products hit the shelves, we found they're often being tested on your kids in your own home.
That's because in most cases, children's products can hit the market without much oversight or testing.
And the risks of potentially dangerous products are only found after there are real problems with real babies.
It is every mother's worst nightmare when you see your baby blue and unresponsive.
Erica Richter's daughter, Emma, was born perfectly healthy and was just 2 weeks old when she died in her Fisher-Price rock and play.
This is my world. This is my life. I made her.
Congressional records show in February 2018, during Erica's pregnancy, Fisher-Price notified the Consumer Product Safety Commission that 15 babies had died in the rock and play. More than a year later, the CPSC finally announced a recall, reporting 30 deaths tied to the product. A recall too late for Emma.
Anybody watching this should be very concerned. You don't want to know what's behind the vault of what they know is killing people.
In 2021, Fisher-Price reported to Congress that it had tallied 97 deaths tied to the rock and play. As more infant items hit the market, it has parents like Erica wondering who is really in control when it comes to notifying parents about potentially problematic products. A mom.
The alarm bells were ringing very early on and it was just ignored.
A pediatrician.
Babies died in those products, but it took thousands of sales for these things to pop up.
And a senator.
There were deaths and injuries that could have been prevented.
3 people with one concern: how baby products end up on the market and in our homes.
You wouldn't think that someone would be able to put something on the market that could potentially kill our infants, and the reality is that absolutely is the case.
For all 3, they can't talk about what's going on today without talking about what happened 5 years ago when the Fisher-Price rock and play was finally recalled, but only after around 100 babies died in the incline sleeper, with reports spanning years.
I just really struggle to understand how we aren't taking what we should have learned from that and applying it.
The concern has to do with the process. In the United States, products like toys and blankets and baby clothes go to market without the government's approval. Regulations and standards, in fact, typically come in after a product is already on the shelves. But what that means is instead of a scientific setup before thousands of products are made and sold, homes are the labs, parents the scientists, babies the test subjects. An impromptu home study that might turn tragic.
Parents in general, they think that all of these products have been approved by a governing body, like the FDA does for medications. And there is nothing like that.
And if there are safety standards, they're often initially voluntary, meaning companies choose whether to follow them. And they're often set through independent organizations. In the case of baby products, that's ASTM International, which hosts dozens and dozens of committees of experts, consumers, and industry insiders who decide the best and safest ways to manufacture products we all use every day. But that process is now facing fire. Critics say it has too much industry influence, reacts slowly, and relies too heavily on death tallies for action.
And then the data that then they use to make decisions are the number of dead children or injuries, accidents that have happened. And so it's a very reactive process rather than proactive.
Shayna Rayfield lost her daughter Claire in a safe sleep incident at daycare. She's now in the committee considering safety standards for infant sleepwear, where weighted sleepwear is currently in debate for voluntary industry standards. The current task, counting incidents possibly tied to the product.
In my head, I'm like, so what's your number? So what number of children that have died would then meet the threshold for some of these manufacturers to actually consider it a hazard?
While many major retailers have already pulled weighted sleep sacks after various warnings, they remain on the market and legal. Now Senator Richard Blumenthal and other lawmakers have proposed a ban.
I don't want to see a repeat of the rock and play debacle, where there were deaths and injuries that could have been prevented, but the sales went on much too long. And we see the same kind of dangers here. Children, infants may be at risk.
We've asked ASTM International for interviews. Every request has been declined. While the mom, the pediatrician, and the senator continue to push for changes for children's safety, Shayna remains on the ASTM committee and continues to voice her concerns for the process and what could happen if things don't change.
The end goal should be safety. It shouldn't be, let's make sure all these products can get on the market and we don't have too many regulations. It should be safety. That's the point of safety standards.
Even with new inventions, there are some broad federal regulations everyone would have to comply with, even if a new product isn't specifically regulated. For example, there are flammability laws for children's clothing and sleepwear, and lead paint restrictions for kids' toys and furniture. Once a specific regulation is set for a children's product, companies must use government-approved labs for testing. Still ahead, it's a sore subject for many parents and a discussion they may want to dodge.
I got that question, when can I have a smartphone, Mom? Sooner than I thought I was going to.
We have an in-depth look at the movement to put teens' first phones on hold and how the government is getting involved in the matter.
But first, a subscription for your health care.
It's kind of like Netflix. You can watch as many shows as you want, or you can watch no shows.
We break down the details of a healthcare model hoping to change your visit to the doctor.
Our in-depth coverage continues. You can get connected to InvestigateTV Plus on all social media platforms.
We trust doctors with our lives.
But most Americans are not confident in the U.S. healthcare system as a whole.
A Gallup poll released in 2023 reveals just 1 in 3 Americans have faith in the medical system.
Now some physicians are taking healthcare into their own hands, creating a so-called doctor subscription service.
Reporter Heather Graff has an in-depth look at how it works and whether it's a viable option for families.
Lee and Tisha, as of 2022, the U.S. healthcare system was valued at $4.5 trillion. We spoke with some doctors who argue it puts profits over patients.
When it comes to healthcare in America, doctors Chris McCarthy and Jerome II put it bluntly.
It's definitely broken, yes. I mean, in most every facet.
It's why they left a traditional hospital setting to open Palmetto Proactive Primary Care in Spartanburg, South Carolina.
That looks great. Let me take a look at this.
Their practice is a model of health care experts say is emerging across the country, known as direct primary care, where patients get premier access to their physician, including same-day appointments and longer visits.
The typical office visit is 7 minutes. My typical office visit minimum is 30. And so patients are surprised when they first come in. They're like, wow.
Dr. Teresa Lovin sits on the board of directors for the American Association of Family Physicians and opened her own DPC in 2020.
And I just really feel like a better relationship builds from that.
For unlimited doctor visits, annual exams, flu tests, urgent care, x-rays, and more, patients pay a flat monthly fee, much like a subscription service.
It's kind of like Netflix. We talk about that as another kind of subscription-based. You can watch as many shows as you want, or you can watch no shows.
What sets direct primary care apart from other healthcare models is that it does not accept insurance, and patients don't have a copay.
I have a monthly fee. You know what that is. You know what it's going to be for the year.
Dr. Lovin says many of her patients have a high deductible through their insurance, and some have no insurance.
It's not recommended anybody go without health insurance, but if you've got a high deductible plan and your individual deductible is $5,000, that's a lot of money to put forth to get any kind of health care.
She says she sees patients on Medicare and Medicaid, and membership fees range from $60 to $100 for an individual adult.
I have patients who are on Medicare who come to see me. I have patients who are on Medicaid who come to see me. So they find a way around even being on the lower income if it's a service that they feel valuable.
What's up, Mike? You got the hot chicken Philly, man?
At Palmetto Proactive, some business owners like Kenneth Cribb are now using this health plan as an option for their workers.
But the face time that you get to spend with your physicians is just unprecedented. You don't feel like a sheep.
A 2024 survey by the American Academy of Family Physicians found about 2/3 of DPCs offer contracts through employers, and 1/4 customize their healthcare plans based on employer needs.
For employees, they're covered at the 50% level, so it costs them about $6.92 a paycheck.
The most common procedures in DPC practices are EKGs, suturing, and biopsy and excision.
We'll put in stitches if somebody needs stitches. They cut their finger. Skin procedures if we need to take care of skin cancer. If we can handle it here, we'll do it.
But one of the most important, according to Dr. Lovins, is preventative care, like lab screenings.
There's a lot of insurance companies that don't like to pay as well for screening labs, looking for things that are going to help you in the long run. You have to find a reason to get a lab, basically. And because of the services that DPC can do with that reduced fee, they can get those screenings done at a much more reasonable price.
And ditching that traditional system, these doctors say, allows them to build a closer relationship for a healthier family.
Just really felt like it was what my calling was as a family physician.
Monthly membership fees for DPCs range from $20 to $49 for children and $50 to $100 for an individual adult.
For families with health insurance, there's another payment model called concierge medicine.
According to a network of hundreds of concierge medicine providers, it's similar to direct primary care, but concierge medicine does accept most insurance plans, including Medicare and Medicaid. Concierge medicine involves billing insurance for services, and members have a copay. On top of that, members pay a monthly flat fee for premium access to their doctor.
Still ahead, baking is a science, but business can be unpredictable.
There's days that we sell out at 11 a.m. and there's days where we end our day with 300 of the 700 bagels we made.
We introduce you to the woman helping a bakery turn day-old dough into daily donations.
Plus, parents dial in on their kids' cell phone use.
These apps are like a brand new magazine every 10 minutes. It's like a constant barrage of information.
We reveal how a community encourages parents to wait before gifting that first phone. You can watch Investigate TV Plus anytime, streaming online. Get the app for Roku, Amazon Fire TV, and Apple TV. They're free to download.
When children head to school, some may have to leave their phones at home.
As of October 2024, at least 8 states have enacted a law to either restrict or ban cell phone use in schools.
12 more states have introduced legislation to either ban or restrict cell phone use in classrooms.
The recent laws add a variable to the equation. At what age should you give your child their first phone?
According to a 2023 survey, about half of U.S. children get their first smartphone before age 11.
When a mom wanted to wait until her kids became teens, she came up with a creative way to help hold kids and parents accountable.
Reporter Erin Conley shows us how it's since grown into a national movement.
The dings, rings, buzzes, and beeps are hard to ignore. With smartphones, you're always just a click away, and that's not always a good thing, especially for children.
When I was young, we looked at magazines and we saw these standards of beauty that still affect the way that I think about myself and my body. The internet, these apps are like a brand new magazine every 10 minutes. It's like a constant barrage of information.
Worried about the dangers and distractions that come with having a phone at an early age, one mom of 3 in Austin, Texas, decided she was on a mission to change those statistics. She started Wait Until 8th, a pledge for parents to delay giving their child a smartphone until 8th grade.
So I wanted to start Wait Until 8th because I got that question, when can I have a smartphone, Mom? Sooner than I thought I was going to.
She started the pledge 6 years ago, and within months, it was in every state.
We're giving kids 4 more years free of the distractions that come with a phone and 4 more years to really be a kid without a phone in their back pocket.
Here in Connecticut, 2,500 parents have signed up. Helping drive that number up is Carrie Langerman, a mom of 2 in Fairfield.
I'm hoping to give them just more time to understand who they are and what they want.
Carrie started a local chapter of the nationally recognized organization and championed the pledge.
So I sent it to about 20 parents that I knew in my kids' grades. And from there, each person told one person. And now we have over 500 families in Fairfield who have signed the pledge.
One of those moms is Megan McHale. Letting kids be kids for longer was something that immediately resonated with her, having a daughter in middle school.
I want her to be a part of our family and to sit down with us for meals and to do her homework in the room where I am so that I know what's going on in her life.
Now a senior at Fairfield Ward High School, Zen Blanks didn't get a cell phone until 8th grade. She says for her, it was not a big sacrifice and the benefits are worth it.
I have a lot of self-confidence now, especially compared to some of my other friends that I guess got their phones at a young age.
One phone by one phone, making a difference in communities across the country.
But if we all do this together, all of our kids will not only benefit from not being exposed to social media and the internet, but they're also going to benefit from a very different type of childhood. They're going to walk a different path than if we had all just given them phones.
And if you think your kid's phone is constantly buzzing, you may be right.
According to a 2023 study, researchers examined a group of teens and their cell phone use.
Teens typically received 237 notifications a day. The study also found the average teen uses their phone for 3 to 4 hours per day. Still ahead, what started as a small way to give back,
I thought I was just going to be a mom driving around in my mom-mobile,
turned into a huge effort to feed people in need.
I never dreamed that I would be doing this at all.
We reveal how this woman is proving in more ways than one that a little love goes a long way.
You can watch Investigate TV Plus anytime online. Just subscribe to our YouTube channel at Investigate TV. You can catch stories and full episodes.
Here's some food for thought. 47 million people in the U.S. go hungry, including 1 in 5 children. Despite that, 145 billion pounds of food winds up in landfills. About half comes from businesses.
When a woman saw her local bakery throw out bagels during the pandemic, she started salvaging them for frontline workers.
Today, her effort continues to rise, surpassing an incredible milestone.
Reporter Joshua Skinner shows us how.
In modern society, there are a lot of bagels.
It's truly an art.
Just ask Jackie Halcrow.
The bagels go through a 24-hour fermentation between when the dough is made and the bagels are formed.
She co-founded Emerald City Bagels a decade ago.
Sometimes it feels like just this little thing that my mom and I made.
There's just one problem.
There's days that we sell out at 11 a.m. and there's days where we end our day with 300 of the 700 bagels we made.
And where do day-old bagels go?
Unfortunately, just go into the dumpster.
Until she got a call from Erin Steiglitz. She runs Bagel Rescue, a nonprofit founded during the pandemic to provide food for frontline workers.
I thought I was just going to be a mom driving around in my mom-mobile.
4 years later, she and an army of volunteers collect bagels from 50 businesses across the metro and just surpassed 2 million rescued bagels.
I never dreamed that I would be doing this at all.
Okay, but where do you take hundreds and hundreds of bagels? Well, many of them go to places like here, the Salvation Army in Southwest Atlanta.
The locations sort through and bag the bagels, where they find themselves sent out to loving, hungry homes.
It makes me feel good when I'm going to do the delivery and the organizer or the person I'm doing the delivery to is like, oh my God, we're so glad to see you.
And who knows? The bagel deliverance could spread.
I do believe that Bagel Rescue could be replicated in other cities,
helping fill stomachs and hearts.
Anytime you make something with your hands, you really want to know that it's going to be enjoyed by someone.
I love a good bagel, and it made me
yes.
hungry just watching that story.
I know, that sandwich, like where they put the meat and everything on there. Good stuff. Good cause, though, too, for sure.
Exactly.
All right, that's it for us here on Investigate TV Plus. I'm Lee Zurich.
And I'm Tisha Powell. Thanks for watching. On the next Investigate TV Plus, a mother's years-long search for answers leads her to shocking surveillance video.
As many times as I watched it, every time I'm rooting for him, like, come on, boy, do it, get up, get up, get up.
Why she believes life-saving care was delayed and how sharing her tragedy could help prevent other families from experiencing a similar loss.